And welcome back. April is Autism Awareness Month, and in 2021, the CDC reported that 1 in 44 children in the United States are diagnosed with an autism spectrum disorder. Now, Heidi Draft-Peppin is a social work care manager from Helen DeVos Children's Hospital. Hi, Heidi. How are you?
Hi, thanks for having me.
Absolutely, our pleasure. You're also, of course, a mom of 2 boys who have autism.
So on the spectrum.
Yeah, you're not only an expert from the Children's Hospital, a parent advocate as well. So you've seen this from both sides here. Can we start with the basics?
Yeah.
For those who can't define it in their own heads, what exactly is autism?
Autism is a social communication language disorder. It's not an intellectual disorder. It's characterized by difficulty with communicating, understanding language, especially social language, and a unique set of behaviors.
And when you say it's not intellectual, can you expand on that? Because a lot of people put those two together, autism with an intellectual disorder.
Yeah, a lot of people do. It's with autism, because they have trouble understanding language and communicating, I think there's a misconception that it's an intellectual disorder. Really, the main issue with autism is the ability to understand social communication. Like, people with autism might have trouble making friends. They might not understand sarcasm. They might have trouble understanding jokes.
Okay. So these really what you're saying really might be the signs of autism, right? Like, if someone didn't know what to look for, what would they be looking for? Those things that you're mentioning now?
Yeah, so some signs of autism in very young children may include not responding to their name, difficult not making eye contact. They might flap their hands when they're excited. They might prefer to play alone, or they might not really want to play with a lot of pretend play. Like, I know my son didn't want to play with toy cars or anything. He just wanted to spin the wheels on the cars.
Okay. Yeah, that was Heidi. That was really going to be my next question. Was, since you're a parent advocate as well, what personally did you see in your 2 boys? So you mentioned that one just wanted to spin the wheels and didn't want to play with it. Anything else that you noticed?
Yeah, so one of the first things that I noticed was my youngest was really fussy, and I couldn't console him by hugging or holding him. And then as he got older, he had really extreme reactions to sensory issues. Like, one time he touched a warm pot holder, and he screamed for 30 minutes just because it was warmer than expected. So sensory issues are one of the signs.
Okay. Of course, any parent listening right now or watching this is going to be making sure that they're paying attention to see if they suspect already that their child may have autism. If that's the case, what's their first step? What can they do?
Yeah, so with autism, the first step would be reaching out to the pediatrician. They might also order a hearing evaluation, because if their child is having trouble responding to their name, they want to make sure that it's not due to a hearing loss. I would encourage parents to make notes of symptoms that they're noticing and to reach out to their teachers, daycare workers, family friends to see if they notice signs as well. Okay,
so if you're noticing things at home, collaborate with where your child is, maybe at school or daycare, and see if that's happening there too. I'm assuming you're obviously going to have to get a medical diagnosis here. Once that happens and the diagnosis has come in, then what happens? What's the next step after that?
Yeah, so after their physician makes the referral for an autism evaluation, and the child is evaluated and has a diagnosis, the first step is learning as much as you can about autism. You might also follow up with occupational therapy for sensory issues, speech therapy for language issues, various behavior therapies, although it's important to remember that a lot of the behaviors associated with autism, like lack of eye contact, aren't necessarily problem behaviors. So yeah, work with your pediatrician on what to do next.
And of course, it looks like some of these stats say it affects boys more than girls. Is that correct?
Yeah, boys are 4 times more likely than girls to be diagnosed.
Okay.
And girls are more, girls' symptoms tend to be a little more subtle.
Heidi, thank you so much for the information this morning. Of course, anyone watching right now would want more information. They can visit the Autism Alliance of Michigan.org. That's the website. Heidi, thanks again.
Thank you.
Absolutely. We'll be right back.